Good morning, everyone. I'm Alon Litz. I'm the CEO and co-founder of Panda Health. This morning, we're here and we're kicking off Pressure Point, a new podcast by Panda to really highlight mental health challenges in the workplace, what people are doing great to improve mental health in the workplace. And, you know, who better to tell the story than people leaders across the country that are driving real change for their employees on a day-to-day basis. And I'm really excited today to have Dr. Lesego Rametsi here with me. She is the Group Head of Health and Wellness for the Absa Group. So that's over 35,000 people. And she'll be here to tell us some tricks, some tips, and what Absa are doing to really create a positive work environment for staff across the 10 different offices that they have across the continent, more than 10 offices, 10 countries across the continent, as well as a presence in the UK and the US. So good morning, Dr. Rametsi. Really great to have you here.
Thank you so much for having me, Ellen. It's really a privilege and an honor to be here.
What struck me about your background is that it's quite unique. What's also unique about it is that it is unexpected, but at the same time, it makes so much sense. So without giving away too much from my perspective, please tell us a bit about your background.
Thank you so much. So I'm a medical doctor by training. So I did my medical degree at the University of Cape Town. And after spending a bit of time doing clinical work, I joined Anglo American in various positions. I used to be an occupational medical practitioner, and I was also head of wellness at some point. And then when I left Anglo, I was the head of health for that division, Kumba Aino. So during my time at Anglo, I got introduced into the space of occupational medicine, which is a subspecialty of public health. So that's what really made me, go and study further in occupational medicine. So occupational medicine really is about, what makes people ill at work. What is it about work that can lead to ill health? And also understanding some of the health imperatives that you have to understand as people come into the workplace, how that would impact productivity, how it would impact them, their health, their well-being. So that's really what it's about. It's also a preventative field of medicine. Where you look at policies and it looks not only at individuals, it has the ability to impact at scale. And I think for a clinician, I used to look at it was about seeing one patient and impacting one patient at a time. And I used to think that there should be something more that one could do, to make a greater impact, at scale. And I think occupational medicine, gives one the ability to do so. And that's really what struck an interest. And I've never looked back. Yeah, so that's really my background. And then thereafter, I did an MBA at UCT. And recently, I've completed an advanced management program with IMD at Switzerland. So that's really my background.
Sure, amazing.
And I'm a mom of 4 boys. I must just put that.
We're going to do a separate podcast on that. I'm a dad of 2 boys, and we barely cope. So I need some tips from the master. Thanks so much for that background. I think unbelievable background, and very clear around scaling impact. And very clear why that background in medicine around problem solving, around first principles is applicable to what you're doing today. I think you've touched on it. I think, work is just, the reality is it's such a big part of our life. And
Absolutely.
If it's not a supportive environment, if it's not a positive environment, there is going to be an impact on the day-to-day. So we'd love to hear your view on that.
So look, one of the things that I think, the pandemic, brought to the fore is you cannot have a thriving business, or you cannot have an organization that's meeting its financial, aspirations without a workforce. So that really goes without saying. And I think pre-COVID, a lot of organizations used to think of wellness as just EAP and a tick box exercise. But when we were faced with a pandemic of that scale, I think all organizations understood that, caring for the employee as well-being, safety, and health became quite paramount. And that really, accelerated, in my view, the importance of having a comprehensive health and well-being strategy and not really just, paying lip service to it, because organizations that really navigated the pandemic, quite well, those that made that North Star. The North Star was, how do we keep our employees safe and well and healthy? And those are the organizations that actually, navigated it with, quite well. And I think at Absa, we did that, as soon as, for us, our decisions were always grounded on how is this going to impact on our, our employees' safety and well-being. And if it was, this will enhance it, that's how we made our decisions. And I mean, it's not a secret that our COVID-19 pandemic response won multiple awards. And it was really around how we rallied as a collective. Senior leadership, the most senior, executives in our organization understood that this was a matter of life and death. And, by putting our employees at the center, it was one of those that made sense. And I think we did really, really well. And I think the main learnings from that, it's, we continue to draw from that as part of our people strategy and also as part of our well-being strategy going forward.
And I'm sure it helped that they had a doctor on the exec team that could help drive that strategy.
Absolutely.
So obviously, if you've got a small team, if you're in the office every day, it's easier to have a pulse on what's going on. But how do you do that at scale? I mean, that's not easy. How many people are in the Absa group at this point? How many offices are you covering, just to set the context?
Look, I mean, we have over 35,000 employees, and we have presence, across Africa. We also have presence, we have a UK office and a US office. So definitely huge geographical footprint. But the scale that we're looking for, it sits with line leaders. So well-being, it's not the responsibility of the wellness team or the wellness leads. It's actually everyone's responsibility. And I think, when we start recognizing and realizing that, it's everyone's responsibility, that's how you get the scale. And that's really one of our strategies, from a mental well-being point of view, that it starts with self. So we look at how we empower and raise awareness, at an employee level. And then we look at the role that line leaders play at a team level, because the engagement of, colleagues on a daily basis, it's really, defined by how they engage with their team members and their line leaders. So if somebody says, I love working at Absa, actually it's that engagement they have on a daily basis with their immediate team and line leaders. So that's why for us, mental well-being, it's the responsibility of everyone across the board. And that's how you really get, the skill that you're looking for.
Yeah, I love that. And I think you made the point previously that it's not a tick box exercise. One, it's the right thing to do, and two, it's good business.
Absolutely.
But how do you drive that consistency? I mean, I agree, and you and your team can't be responsible for this alone. But how do you drive that responsibility and, importantly, the consistency across your different line managers, across all those different offices? I know you've got a remote setup as well, or a hybrid setup, so everyone's not in the office necessarily at the same time. So that's not easy.
Absolutely. It's not easy, and it's something that takes time. And I'll be the first to say that we are on a journey at Absa. It's not perfect, but we've put in the building blocks, really, that probably will set us up for success. So our strategies, it's delivered, at 3 levels. So I've said that at an individual level, we really look at empowering and enabling our colleagues to take care of themselves, from a physical point of view, because we do know that our physical well-being is closely linked with your mental well-being. So exercise, data is starting to show the importance of exercise in, optimizing and enhancing mental well-being. And in addition, we're starting to see that exercise actually, it forms part of the prescription of common mental health challenges. So we know that there's better outcomes if you've been diagnosed with depression or anxiety and if you exercise as well, because of the endorphins, serotonin, and all that. So we know that exercise is quite important, even in the management of common mental health conditions. So exercise, the importance of sleep. We do know that individuals who do not get the requisite 6 to 8 hours of sleep, every night, are at risk of developing, mental health challenges. So, exercise, sleep, nutrition, the importance of a healthy diet in maintaining our mental health. And the fourth thing is around mindfulness, and probably you know more about me, more than me on mindfulness. But really, what are the practices that one, can employ and deploy to deal with stress? Because stress is going to be with us, for a long time to come. There's quite a lot of changes that we have to grapple with in South Africa. There's load shedding, the cost of living is increasing. There's a lot of pressure that, all of us have to concede with on a daily basis. But how do you manage your stress levels in a way that it does not tip you over? So those are the things that, we empower colleagues and give them the skill sets to manage their mental health. So that's a very important thing. So what is it that one should be doing on a daily basis to optimize their mental health? And one of the things that we've partnered with the Neuro Leadership Institute, using neuroscience to understand micro habits that people can build on a daily basis to optimize mental health. It's the same as exercise. You cannot wake up and say, okay, tomorrow I'm going to run a half marathon. And it's about doing small bits of exercise and building on that. And it's the same with mental health. It's about what are those micro habits that you can employ to manage your stress levels. So that's the work that, we empower our employees to do the work to take care of themselves. But we also recognize that if you have a healthy individual and you bring them into a space where it's not conducive for mental health, with time, the mental health will be impacted. So the second layer of work that we're doing is at the team level, where it's a line leader led, type of process, where we capacitate our line managers on mental health and mental ill health, how to take care of yourself, behavioral modeling, how do you, model positive behavior to enhance mental health. And I think you've talked about hybrid organizations. As Absa, we are a hybrid organization. We have colleagues that work remotely, some that work in the office. And how do you manage boundaries? Because that's some of the things that people grapple with, around managing boundaries at work and at home. And I think if you recall during COVID, that's one of the things that, as a transition, most of us did not get right. Work and home became this, one. And how do you really manage that to optimize work outputs and also home life?
I think I just want to pick up on some of those key points that you've made. I think, first of all, on the individual level, I love the concept of micro habits and starting small. I think when people look at these problems and they seem daunting, you're never going to start. But if you break it up into little pieces and start small and build from there, that's the way to ultimately achieve it. And I love your focus on proactive healthcare. I think we're too reactive generally, waiting for problems to arise versus doing more upfront to address those issues. And those are all, whether it's exercise, nutrition, outlets from a balance perspective, making sure that you have those opportunities to let go of stress and build resilience are critically important. I'd love to touch on, though, you've mentioned the work you're doing from a neuroscience perspective. Something that I always used to say, and you took it to the next level, is that the only constant in organizations is change. You've said the only constant in organizations is exponential change, and I may steal that moving forward. But how do you prepare people for change? I mean, it's easier said than done. It's difficult. Change is hard.
Change is hard. I think humans are creatures of habits. I mean, if we had a choice, we would do the same things every day because that's when we are at our most comfortable. But unfortunately, we're living in unprecedented times, and exponential change definitely will be the constant going forward. So it's important that we support, employees, colleagues with building resilience. And, resilience has been one of those words that has gained a lot of prominence over the past 4 or 5 years. And people talk about bouncing forward, bouncing backwards. But inherently within resilience, it's really, our ability to deal with either stress or an event, that has changed us somehow, or grief, pain, loss. So for you to be resilient, to say, geez, I think I am resilient, you probably have, have had to deal with a traumatic experience. So what is important is our ability to bounce forward. So for me, the definition that I like around resilience is our ability to bounce forward after, an adverse event that we have to concede with. And it's a given. All of us, will deal with a traumatic event, and our ability to navigate that really talks to how well we prepare ourselves even before that happens. So I've talked about mindfulness practices, simple things around breathing, practicing gratitude. There's a lot that, if you wake up and you have to think about challenges that, we have to concede with. It's easy to say, geez, this is the end of it. But if you have a positive mindset, if you frame things positively, and you wake up and you think about 3 things that you're grateful for, that definitely would fuel you, to go through the day. And I always say to people that it's about one step at a time. And I mean, these are the things that we teach our kids, that, if you have a problem that seems insurmountable, if you take it in small chunks, those are things that would make you, really overcome. So we spend a lot of time looking at, programs and strategies that build resilience, so that when these adverse events happen, when these traumatic events happen, when there's a setback, you are you have a tank that's already full. And by the time you've overcome, at least you are halfway or so, and you can start building on that.
Yeah, I love that. I think you got to keep your tank full. If you're not doing that, no one's going to do it for you. And resilience, I think the world, as you've said, is only going to get more complicated, more unknown, more variables that we're going to have to navigate. So it's definitely the skill, I think, of the future if we had to identify one. So maybe focusing on something slightly different, how do you empower managers to really pick up those warning signs before it's too late? If potentially an employee is heading to a space where they may be at risk of burnout or at risk of, performance issues related to their mental health, how do you prevent that from reaching a reactive response to a proactive one?
So before I even answer that, I like, how you use the word proactive and preventative. One of the principles in primary healthcare is prevention has a better outcome. So those are first principles. And Additionally, uh, one of the things that also carries a better prognosis is early diagnosis and early identification. So one of the things that we've employed as a strategy at Absa is we have partnered with mental well-being partners, where we have two types of programs that are available. The first one is for line leaders, where we take them through, basics of mental health. What is mental health and what is mental illness? Because the two words are sometimes used interchangeably. So them understanding, basics around what is mental health, what is mental illness, common, mental health conditions and how they present. And that really empowers line leaders to have a heightened sense of awareness, but also to identify early on if there's a colleague or an employee that might be, presenting with some of these symptoms early on, and making them aware of the support that is available both to the employee, the team, and the line leader, because we do have support that's available across the board. And then additionally, we also take them through some of the occupational factors that drive ill health, mental ill health. For an example, if you have a team of 5 people, and of the 5 people, there's only 2 that carries the team, the other 3 are not doing what they meant to be doing, then you don't have an even distribution of workload. And in the long term, your 2 people that are star performers are at the risk of burnout, whilst the other 3, are not doing what they meant to be doing. So some of those, they might seem like simple things, but sometimes line leaders might not have the full comprehension of, long-term impact of, uneven work distribution. So that's a simple example. The other one is around how we recognition. Recognition plays a very important role in people's mental well-being. So how do we recognize people when they go above and beyond, when they excel in that role? So those are some of the, because we know recognition actually has a positive mental health outcome when people are recognized for the work that they do. And also, respecting boundaries. And if you work at 2 a.m. every morning, from 7 till 2 a.m., it sets the tone for the team without you knowing. And those are some of the things that might drive burnout. So we really look at what are some of the occupational factors that impact on mental well-being. And I've talked about, we empower line leaders also on how to take care of their mental well-being so that they can role model positively the behavior that we want to see. And that's long-term work. It's a lot of work. It requires commitment. But I really believe that, with time, we will start seeing the impact and the scale and the positive outcomes that we really looking forward to. And we know the World Health Organization says mental health is the next pandemic. Yeah. Workplaces are the microcosm of the greater population. So whatever is happening, in the population, we're starting to see it in the workplace. And I think now we used to the World Health Organization pre-COVID, I think they said 1 in 4 individuals will have a mental health condition in their lifetime. I think that number now is sitting at 2 in 3. So if workplaces are not geared up, and proactively so, to deal with mental health challenges, it will definitely hit the bottom line in the long run. So a proactive mental health strategy actually is quite key, currently and going forward.
Yeah, look, I love the way that the strategy is so comprehensive and covers so much. I think, unfortunately, one of the challenges that we see with mental health is stigma is still a massive issue. So how do you overcome that? How do you show people that it's okay to not be okay, that it's okay to flag these issues, have these conversations in a way they're not going to be, ostracized from their colleagues?
I think that starts with creating psychological safety. So that's really the first thing. It's creating an environment where people can speak up and say, I'm not okay. And our ability to do that is really through sharing our stories. So we have, we every Monday we have Mindful Mondays, which is open to all colleagues, and there we encourage colleagues to share their stories, because our ability to fight stigma really starts with sharing our stories. So we're really big on storytelling. And additionally, we have support groups at work, which are facilitated by psychologists. And these, are done virtually. And this has been probably one of the greatest gifts from COVID, that we used to have physical support groups, and they were quite limited. But because now it's in the virtual space, we are able to reach colleagues, across the entire organization. And that also supports other colleagues in that space. It's a safe space where they can share how, they've navigated challenging times and the support that they've received from the organization. And as people share, more of those stories, it gives others the permission to also come forward and share. So we're still at the beginning of that, but I really hope with time, as more and more people hear these success stories and they realize that, Lesego shared her story, she's still here, she got promoted. That's really how you create, the groundswell and people understanding that just this information will not be used against me. So we are on the journey as well from that point of view, but we really encourage our colleagues to come forward and share their stories when an opportunity presents itself.
Yeah, look, I think normalizing these issues, speaking about these issues, what we see in our live sessions as well is that often for people, even just to join a session, not even participate actively, but just hear another person speaking about a situation which is similar to theirs, is the beginning of that healing journey. Absolutely. Because you're often sitting there in silence thinking, I'm the only one facing an issue. And for the first time, you actually realize that's not the case. And the reality is, in 99.9% of the cases, that's the reality, that there are other people facing exactly the same issue as you. So just sharing and being open to listening to others is really the right starting point.
And I also believe sharing our stories actually save lives. If I recall, last year we had a 2-week, mental health awareness campaign. And one of the days we talked about, men's mental, well-being, suicide, because we know that the risk of suicide in men is a lot higher. And I was quite amazed that, there's a gentleman that even posted that, I'm so glad I attended today's session because I was really contemplating this. So, when we give people, permission, we give people permission, to validate also how they feel, because somebody's going through exactly that same, situation. And I'm glad that, because that person decided to join on that day, they made the right choice, because we were able to set up support, immediately for them. So I firmly believe that sharing our stories validates people. They do not feel alone, and also it saves lives. And I think ultimately, if we can save lives, as a doctor, that's what I would want to see.
Yeah, so kudos to you. I think the fact that you've created that psychological safety in the organization where someone is willing to share that is testament to, all the things that you've spoken about. I think we're reaching the end. I think maybe one personal question and then one general one in closing. We've mentioned exercise a lot, and we were chatting a bit before. Tell us about, what is your trick from an exercise perspective?
Look, I try and get exercise 5 times a week. So I wake up quite early. So I wake up at 4:30.
4 children, remember. As well.
Yeah. So 4:30 in the morning. And the reason why it works for me is because I have 4 kids. And when I wake up, they're still asleep. So I always tell people that it's the first hour of the day where life is all about me. So I make sure that I claim it and I use it for exercise. So I do, if I have time, I do about 5 to 10 minutes of meditation as well, just to ground me and get me ready for the day. So that's So that's what I do. Exercise is quite important. And then additionally, I try and get 10,000 steps per day. Working remotely, working from home, it's difficult to get your 10,000 steps. So I make an effort to really slot it in 3 times a day. I walk around and I get my 10,000 steps. So those are the two things from a physical activity point of view that I do quite religiously. I try and eat well, healthy, but that does not mean I don't eat chocolates once in a while. I do. And I try and drink my water as well.
So you're practicing what you preach. I love it.
Yeah, 90% of the time.
That's okay. Anything in an extreme is not necessarily a positive. So maybe last question in closing. I think we've chatted a lot about the work environment. Hybrid environments obviously have a lot of benefits, but something which can be at risk is that social connection. So maybe in closing, what are your tips to retain that social connection for teams? Because that's so critical to have a functioning team, to have a positive work environment. How do you maintain that connection for people?
I think it's something that we must really pay huge attention to. There are lots of benefits, for remote working, but there are also unintended, outcomes. And, if I think about, for an example, if you have colleagues that live alone, for them, going into the office gives them that dose of social connection. Because human beings, by nature, we need social connections. And one of the reasons why we saw an uptick in mental health challenges during the height of the pandemic was with lockdown, restricted movements. There were people that could not get that social connection. So social connections are critical in maintaining positive mental health. So we have to think about how do we arrange our work environment in a manner that it still allows for playtime, connection time. And I think a lot of creativity actually happens when people are in the room as opposed to being behind screens. So I think we must be deliberate and intentional about creating opportunities where social connections is still there. Playing together as a team, strategizing, and all those good things that, enhance connection. The other thing that, we're starting to see is that, individuals that are in abusive homes, going into the office used to give them a reprieve from that environment. So you have to think about special circumstances where, coming into the office actually would be beneficial for colleagues. So when you look at your wellness strategy, your mental wellness strategy, you have to think about levels of customization where you look at what are your high-risk individuals, what you should be doing to support them without actually, stigmatizing them. So very fine balance, but you have to be attuned to your data for you to be quite responsive and make sure that you have a totally inclusive strategy that supports everyone. It's not an easy thing, but I think definitely data-driven, insights-driven. It's really around having your finger on the pulse and understanding what your environment looks like, what are the high-risk factors, and having, strategies that you can always, fine-tune, because it's an iterative process. You learn as you go along. And it's having that learning mindset that, always thinking, is this working? If not, how do I modify it and make sure that, it's fit for purpose?
Yeah, well, look, love that. And I feel like we could keep on chatting, but I think we're on time. So really appreciate your time. I think, firstly, clearly Absa execs and Absa employees are super lucky to have you. This is not a strategy that just happened.
I think team effort.
but 6 years in the making, clearly very deliberate, very data-driven, very insights-driven, very people-focused, very proactive, very preventative, all the things that we love to hear. So congrats on the impact that you're making. We'll continue to watch you make that positive impact, and really thank you for your time.
Thanks for having me, Alan. It was lovely. Thank you.